I call to order a meeting of the Marshalltown City Council. We're at 10 West State Street, June 21st, 2025. If you'll join me for the Pledge of Allegiance, please. Thank you. Let's have roll call, please.
Fonseca.
Here.
Kell.
Here.
Lottiehoff.
Here.
Mitchell.
Here.
Nichols.
Here.
Schneider.
Here.
Thompson.
Here.
Thank you. We're at public comment. Members of the public may make comments on any item that was not on the agenda during this time. The speaker shall approach the microphone and state their name and address. Comments shall be limited to 3 minutes unless a longer comment is authorized by the mayor. The speaker shall direct comments to the mayor and the council as a whole. The mayor and council may provide a response to the public comment, but shall not engage in discussion or debate on items raised by members of the public. No action may be taken on items raised in public comments to comply with open meetings laws. With that, the floor is open to the public.
Hello. There we go. My name is Nikki Ahrens. My address is 502 Hidden Hill Drive here in Marshalltown. It's kind of on the northwest side of town. I am here this evening because I am requesting an exception to a city ordinance. I spoke with my representative, Mark Mitchell, and he thought that this was kind of the best way for me to get started with that process. According to the ordinances, Ordinance 90.001 states that the keeping, stabling, or housing and pasturing of roaming of ruminants, cattle, sheep, goats, horses, mules, asses, or swine, except within a lot over 2 acres, is prohibited. I currently live on a lot that is 2.5 acres. The second ordinance is 90.002 that says, I'm going to skip ahead, keeping or maintaining of poultry or domestic fowl in an area of the city which is zoned residential is prohibited. My request here is for an exception on keeping chickens, basically. We live on a piece of land that is big enough for me to have cows or sheep, but not a couple of chickens in the backyard. I'm not looking for roosters. I'm just looking for a little bit of land or a little bit of exception so I can keep a couple of hens in my backyard. I brought along a map that shows our property, the property boundary, and my husband went through and kind of mapped out the different distances to the different houses nearby. The closest house is over 330 feet away from my backyard. And that's just one. Most of them are over 400 feet away. So that is my request. I'm not really sure what the next steps are, but I would like to request this exception, please.
Carol, do you have next steps that she might take?
Yes, I spoke with you on the phone.
Yes.
And so I explained that there aren't really exceptions to this section of the code, that it would most likely need to be a change in the ordinance to either allow chickens, poultry in general, or to put some sort of size restriction like what we have for other types of animals husbandry. So, I would wait for direction from council regarding if we wanted to initiate any changes there. I can bring it back at the next meeting as a discussion item.
Okay.
Don't go down this road. During public comment, please don't go down this road. I'll give you my card, call me.
Okay, that works. Thank you.
Floor is still open. Anyone else? Last call. Okay. Mayor, council comments? Does anyone have anything? The only thing that I have is we are coming up to the 4th of July. I'd like to thank the county for their donation again this year of $2,000 toward the fireworks fund. We need people to donate. If you like having that celebration, it's not free by any means. We do need donations to come in. If you'd like to mail a check to the Chamber of Commerce, write out the check to Medic, and in the information line, put fireworks. So the only other thing I have is I'd like to introduce everybody to Kelsey Stafford. Everybody, yeah, I'm embarrassing her, I'm sure. Our new Parks and Rec director, she started last week. And from what I hear, everybody is still smiles, so that's a good thing.
Did you want me to come on? Yeah, just did. Okay, yes, I am Kelsey Stafford, the new Park and Recreation Director. Started last Monday, so I'm 1 week in, and having a great time learning all of the city processes and getting acquainted, so very blessed to be here. Thank you very much.
Thank you. Anyone else? Okay, moving on to the consent agenda.
Move to approve, Your Honor.
Second.
Have a motion and a second. Any questions up here? Roll call, please.
Mitchell,
Yes.
Nichols,
Yes.
Schneider,
Yes.
Thompson,
Yes.
Fonseca. Yes. Kell,
Yes.
Lottiehoff.
Yes. Okay, moving on to motions.
Motion to approve the Friends of the Orpheum alcohol license with outdoor service for Live After 5 events on July 3rd, July 11th, July 18th, and July 25th at West End Park.
Move to approve.
Second, Your Honor.
I have a motion and a second. Any questions or comments from the councilors? Anything from the public? Roll call, please.
Kell,
Yes.
Lottiehoff,
Yes.
Mitchell,
Yes.
Nichols,
Yes.
Schneider,
Yes.
Thompson,
Yes.
Fonseca. Yes.
Okay, moving on to resolutions.
Resolution to approve city fee schedule for July 1, 2025.
Move for approval.
Did you say move yourself?
Second.
I have a motion and a second. Any questions or comments from councilors? Anything from the public? Roll call, please.
Fonseca. Yes. Kell,
Yes.
Lottiehoff,
Yes.
Mitchell,
Yes.
Nichols,
Yes.
Schneider,
Yes.
Thompson,
Yes.
Okay. Resolution number 2.
resolution accepting the agreement with Municipal Collections of America, Inc. for the collection of unpaid automatic traffic enforcement citations.
Move to approve. Second.
Okay, can we have staff member? Thank you. Chief Chris Jones?
Chris Jones, Chief of Police. This new contract is a result of a contract that the council had approved last March for us to use a collection agency or collaborate with a collection agency as part of our ATE civil penalties. That company that we had been contracted with had notified us and said that they had went out of business. Staffing had done some research. We had talked with some other agencies and our legal team, and Carol has had some experience with the company that we are looking at moving forward or signing a new contract for debt collection, which is Municipal Collections of America. And we'd like approval to move on with that contract.
Question? Anything from the public? Roll call.
Thompson?
Yes.
Fonseca? Yes. Kell?
Yes.
Lottie Hoff?
Yes.
Mitchell?
Yes.
Nichols?
Yes.
Schneider?
Yes.
Okay. Moving on to number 3.
Public hearing and resolution approving the real estate purchase agreement and providing for the conveyance and transfer of title for 501 North First Avenue.
Okay, I declare the public hearing open at 5:41. Can we have staff review?
Good evening, Clayton Ender, Assistant Director, Housing Community Development. The bid recommended to be moved forward on this property is for Troy Klein in the amount of $10,000 for purchase of 501 North First Avenue. The purchase does come with the following timeline conditions. Building permit would need to be applied for within 30 days of closing. Work would have to start on the property within 90 days of issuance of a building permit. Exterior work has to be complete within 180 days of issuance of the building permit, and all work, exterior and interior, must complete within 1 year of issuance of a building permit. The approval would include a right of reversion of the city, so if Mr. Klein were to fail to comply with any of those timeframes, the city reserves the right to take possession of the property back. With that, staff is recommending approval, and I'd be happy to go into further detail or answer questions as needed.
Thank you. Do we have any written comments?
No, Your Honor.
Okay. Anybody from the public like to comment on this? Hearing none, I declare the public hearing closed at 5:42 PM and move on to the motion.
I so move. Second.
Have a motion and a second. Any last questions or comments? Roll call, please.
Lottie Hoff?
Yes.
Mitchell?
Yes.
Nichols?
Yes.
Schneider?
Yes.
Thompson?
Yes.
Fonseca? Yes. Kell?
Yes.
Moving on to item number 4.
Public hearing and resolution approving the real estate purchase agreement and providing for the conveyance and transfer of title of 915 South Center Street.
I declare the public hearing open at 5:43 PM.
Good evening again. The winning bid on this property was by Dean Lothers in the amount of $1,000. This particular property, Mr. Lothers requested the ability to potentially sell the structure to be moved to an off-site location or demolish if not done within a time frame. The time frame that would be applicable here is they would have 60 days from date of closing to either identify a person to move the property or to purchase the property, and they would have to obtain all necessary building permits within 90 days, and then demolition would need to be completed within 180 days from closing as well, so really moving it along. And then kind of jumping ahead a little bit to 919, because they're kind of a package deal here. Very similar timeframes, other than that one doesn't include a move. That one just is the demolish. And while I don't have a lot of details to share, I have had heard some preliminary interest that the property may already have interest for some retail development there for demolition and redevelopment. So hopefully some good news going there. I don't have much more to share at this time on that.
Thank you, Clayton. Do we have any written comments?
No, Your Honor.
Anything from the public?
So I actually just have, my name is Marco Yepes Gomez.
11 North 6th Street. I actually just have mostly, positive things to say about this. So I've been following 501. It was the last public hearing, and this one, and the next one after this one. So I just kind of consolidated all my comments into one. Anyways, I wanted to express how happy I am with these 3 parcel sales. Specifically the center properties that have the potential to be something more of value than what they are now. I want to briefly thank council members Nichols and Kell for echoing the importance of adding stipulations to these agreements a few meetings ago. I also want to thank the housing department in Clayton for making sure all 3 of these agreements end up being a great win for everyone. As I mentioned a few meetings ago, I still believe the way we deal with surplus land needs work, so these agreements always end up aligned with our public interest. Ensuring most surplus parcels are sold to someone who is committed to making parcels productive again is a goal I want to passionately advocate for. I have personally looked up and driven to 10 empty parcels the city has bid off since 2021. All but one has turned into something different than an empty parcel. Every time we sell our surplus parcels, we must consider stipulations in the buyers. If we don't, we keep having these land speculators winning bids and driving our neighborhood's confidence down with their empty lots. To finish, I am happy the way these agreements ended up happening and have nothing to complain with the final result. I want to work towards this being the new norm for most surplus properties we bid off. Thank you.
Thank you, Marco.
Yep.
Anyone else? Okay, I declare the open meeting closed at 5:46 PM and move on to the resolution.
Move to approve. Second.
Have a motion and a second. Any other comments from the councilors? Roll call, please.
Mitchell,
Yes.
Nichols,
Yes.
Schneider,
Yes.
Thompson,
Yes.
Fonseca,
Yes.
Kell,
Yes.
Lottiehoff.
Yes. Okay. Number 5, please.
Public hearing and resolution approving the real estate purchase agreement and providing for the conveyance and transfer of title for 919 South Center Street.
I declare the public hearing meeting open at 5:47 PM. You're up.
Very similar to your previous item here, same buyer here, Dean Lothers, in the amount of $1,000. Intent is to demolish this. This does not include an ability to move the structure. It's just for demolition. They would have to pull the permits within 30 days of closing and commence the work within 90 days.
Thank you. Do we have any written comments?
No, Your Honor.
Okay. Anyone from the public like to speak to this? Hearing none, I call the public hearing closed at 5:48 PM and move on to the resolution.
Move for
So
approval,
moved.
Your Honor.
I have a motion. Do I have a second?
Second.
Okay, I have a motion and a second. Any last comments from the council? Roll call, please.
Schneider,
Yes.
Thompson,
Yes.
Fonseca,
Yes.
Kell,
Yes.
Lottiehoff,
Yes.
Mitchell,
Yes.
Nichols.
Yes.
Okay. Moving on to ordinances. Number 1.
Ordinance 15101 to amend the official zoning map for 915, 917, and 919 South Center Street from medium-density residential zoning district to mixed-use zoning district. Third reading.
Entertain a motion.
I so move. I'll second then.
Have a motion and a second. Any questions or comments by the council? Anything from the public? Roll call, please.
Kell,
Yes.
Lottiehoff,
Yes.
Mitchell,
Yes.
Nichols,
Yes.
Schneider,
Yes.
Thompson,
Yes.
Fonseca,
Yes.
Moving on to ordinance number 2.
Ordinance 15102 to amend the official zoning map for lots 1, 2, 13, 14, 15, and 16, Block 1, Woods Addition to Marshall, Marshall County, Iowa, and lots 1, 2, 3, 4, and 5, Block 2, Woods Addition to Marshall, Marshall County, Iowa, and lots 11, 12, 13, 14, 15, 16, Block 3, Woods Addition to Marshall, Marshall County, Iowa, from medium-density residential zoning district to general industrial zoning district. Third reading.
Move to approve.
Second.
I have a motion and a second. Any questions or comments from the councilors? Anything from the public? Boy, you guys are quiet. Roll call, please.
Fonseca? Yes. Kell?
Yes.
Lottiehoff?
Yes.
Mitchell?
Yes.
Nichols?
Yes.
Schneider?
Yes.
Thompson?
Yes.
Okay. Ordinance number 3.
Ordinance 15103 to amend the Code of Ordinances, City of Marshalltown, Iowa, Chapter 156, zoning, self-service storage, mini warehouse. Third reading.
Move to approve.
Second.
I have a motion and a second. Any questions or comments from anyone? From the public? I think they're dead. Roll call, please.
Mitchell?
No.
Nichols?
Yes.
Schneider?
Yes.
Thompson?
Yes.
Fonseca? Yes. Kell?
Yes.
Lottiehoff?
Yes. Okay. Item number 4, please.
Ordinance 15104 to amend the Code of Ordinances, City of Marshalltown, Iowa, Chapter 156, zoning, accessory dwelling units, Board of Adjustment procedures, and residential building materials. Third reading.
Move for approval, Your Honor.
Second.
I have a motion and a second. Any questions or comments from the council? Anything from the public? Roll call, please.
Lottiehoff?
Yes.
Mitchell?
Yes.
Nichols?
Yes.
Schneider?
Yes.
Thompson?
Yes.
Fonseca?
Yes.
Kell?
Yes.
Item number 5, please.
Ordinance 15106 to amend the Code of Ordinances, City of Marshalltown, Iowa, by amending Chapter 52, Sewers and Sewage Disposal, by amending Section 52.029, User Charge System. Third reading.
Move to approve.
Second.
I have a motion and a second. Any questions or comments from the councilors? Anything from the public? Roll call, please.
Thompson?
Yes.
Fonseca?
Yes.
Kell?
Yes.
Lottiehoff?
Yes.
Mitchell?
Yes.
Nichols?
Yes.
Schneider?
Yes.
Item number 6, please.
Ordinance 15107 to amend the Code of Ordinances, City of Marshalltown, Iowa, by amending Chapter 53, Stormwater, by amending Section 53.024, exemptions and credits available. Third reading.
Move to approve.
Second.
I have a motion and a second. Anything from the councilors? Do we have anything from the public? Roll call, please.
Nichols?
Yes.
Schneider?
Yes.
Thompson?
Yes.
Fonseca?
Yes.
Kell?
Yes.
Lottiehoff?
Yes.
Mitchell?
Yes.
Item number 7.
Ordinance 15108 to amend the Code of Ordinances, City of Marshalltown, Iowa, Chapter 133, Offenses Concerning Minors. First reading.
Move to approve.
Second.
I have a motion and a second. Chief Jones?
Thank you. Chris Jones, Chief of Police. We've worked at streamlining our offenses concerning minors ordinance that hasn't been reviewed for quite some time. We had an opportunity to take a look and build some consistencies in our curfew laws, which were kind of sporadic depending on age and location within the city, just to make it standardized throughout the city that we're looking at 11 p.m. curfew people under 18. There are some exceptions that are listed in the ordinance for people that are working or legitimately out in the general public after 11 o'clock. We also brought in some consistencies with the state law about selling and possessing tobacco, which is consistent with state and federal law. And then there was some other language that was associated with our ordinance that no longer applies to billiard rooms and and such. So be open for any questions.
Your Honor, I have a question.
Yes, you may.
Chief, so the law for buying cigarettes or tobacco changed from 18 to 21, like statewide. When was that happened?
There was a federal law that went into effect in 2019, and the state law changed in 2020.
Okay.
And we just haven't came back to change the ordinance. We've been, from the police department standpoint, been enforcing our state law, and this would allow us to cite juveniles under city code rather than state code.
Okay, sounds good, because I think when I was 18, it was still legal to buy it when I was 18, so it just changed. So
Well, when I'm
not
dating
that
myself, there wasn't any laws, so you run down to the store.
Anyone else have any questions for the chief?
For cigarettes. Yeah.
Thank you.
Don't, thank you.
Do we have anything from the public?
Hello, Jim Shaw, 522 North 2nd Street. This might be a coincidence, but the mayor's not here and this meeting's going really fast. Thank you.
We're moving along. Anybody else? Okay, roll call.
Laddihoff,
Yes.
Mitchell,
Yes.
Nichols, Nichols,
Yes.
Schneider,
Yes.
Thompson,
Yes.
Fonseca, yes, Kell,
Yes.
You didn't call my name. Yes. Okay, discussion item is the EMS Consultant Collaborative Project.
Yes, Sherry King with Unity Point Health is actually going to present this item.
Thank you, Carol. Yes, I am here representing not just Unity Point Health, but certainly also our EMS task force. So I'm going to cover a little bit about current state, where we are, why this is coming before you now, and we do have some task force members in the room as well. So in case we have questions, we'll do our best to answer those. So currently inside Marshalltown, and certainly inside Marshall County, our emergency medical services, and I'm talking ambulance, is currently provided by Unity Point Health Marshalltown. Now, it's important to know that there are two components of any ambulance service that's doing that. One component is the 911 service. That is the service that we are talking about tonight. The second part of service is transfers, and that is the responsibility of any hospital or facility to move a patient from location to location as the medical need arises. But our focus tonight is just on the 911 piece. Our current 911 setup, it has no funding from any other source other than what it can bill. Obviously, not all services that they provide can be billed. For example, if a patient declines to go to the emergency room once EMS shows up, then there is no bill that can be dropped. There are also frequent denials by insurance for services that are rendered. That then requires a denial and an appeals process in order to make that process go through. Some of those appeals are successful, some of them are not. So right now, neither the city nor the county provide any funding to Unity Point Health Marshalltown for providing the service. The wrinkle here is that I think a lot of our taxpayers think they are paying for this service, and that this is something that is already covered under our as an essential service. We do have some volunteer EMS services here in Marshall County. However, they too are feeling the stress of dwindling workforce, dwindling volunteerism, and then maintaining trained responders, because their responders have to go through training just like all of our other EMTs, emergency medical technicians and paramedics, and then managing equipment costs and the maintenance of that equipment. Obviously, we look at all of our departments every year as we do a review and look for where are there potential hotspot areas. EMS has been one for the last, I would say, 3 or 4 years, possibly more.
The concerns that we continually see are challenges with staffing, which includes a decreasing number of students going into EMT or paramedic schools. There has been a marked decrease across the entire state, so the workforce continues to dwindle. The other has to do with financial loss because the cost of the service is not reimbursed. The reimbursement does not even cover the cost to deliver the service at this point. So, we are very unusual in Marshalltown and Marshall County. It is unusual that you would have a hospital that would be delivering 911 service. Transfer is typical, 911 is not. There are some options for other types of hospitals to get some funding. County hospitals are able to leverage an EMS tax. We are not a county hospital, so that is not available to us. Critical access hospitals actually can allocate some EMS staff hours to other hospital departments within their organization and receive some reimbursement through Medicare. We are not a critical access hospital, so again, that does not apply to our situation. This puts us in a really odd arena. We are in a very unusual state. I think there's only 2 or 3 other services statewide that are even remotely like us in that it's a hospital provided service. So funds that are associated with EMS operations typically, as we said, are come through the transfer piece, occasionally with transport, but not consistently. If a patient is not transported into the hospital, there is no reimbursement. The other thing to know is that our Marshalltown Ambulance Service is a department of the hospital. They are not a freestanding entity with their own tax ID number. They operate as a department of the hospital. So depending on the disposition of a patient who does come into our service, there may not be any bill that can be provided anyway for the 911 portion of the service. It may very well be bundled into an inpatient stay, for example, that patient may be needing because of their medical condition. We are seeing a lot of growing concern around EMS deserts across the state of Iowa. I was just on a call earlier today where both Greene and Guthrie counties were saying, if you find a solution for EMS, by all means tell us what it is, because nobody has really been able to crack that code yet. As mentioned, staffing and the daily operations continue to be a significant stressor, and the unfavorable reimbursement for the service is also a significant challenge for us. I do want to touch on the essential legislation. In 2021, Governor Reynolds did sign a bill that allows emergency medical services to be treated the same as fire and law enforcement and be considered essential. What this allows for is for a tax to be applied to the residents of that entity, whatever it's going to be. There are 2 options for that. There's a local option for income surtax that cannot exceed 1%. There's also a property tax not to exceed 75 cents per $1,000 of assessed value. Those are options that are available now to cities and counties that was not available prior to 21. And we have been seeing a definite uptick across the state by counties really pursuing some of those options. Even just last year, Tama County really pushed into it hard. So it's certainly being recognized across our entire state. That if an essential service bill is to come forward, it has to pass with 60%. So that is one of the criteria. I will say that what really transpired is we were looking at the nature of the service that we're providing, the challenges we're having with staffing, and the financial loss we're taking. That's really what signaled, hey, we have a problem, certainly in Marshall County. We need to work collaboratively to find a solution that will be long-term sustainable, because right now, our current model is not sustainable. We talked with, when I say we, I mean we at Unity Point Health Marshalltown, we signaled the problem to some of our local stakeholders early in 2024. We followed that up with 2 meetings with our EMS providers across the county and also with elected officials last spring. And then following those meetings and gathering a lot of information from those involved, it was determined that our best step forward is to develop a task force. That task force was developed, and I think we started meeting about 10 months ago, give or take, to really try to dig into what is a long-term solution for our county in this regard. What does that need to look like? Is essential service a part of that? What are we going to make that whole package look like so that we can have a long-term solution for our citizens? So that is where we stand today. And I know that group has been meeting actively every 4 to 6 weeks for the last few months. And the most recent activity has been around potentially exploring bringing in a consultant to help identify what services do we really need in order to make sure we're setting this up for long-term success and not just putting a Band-Aid on to deal with in 3 more years. So that is where the task force is today. Questions?
Your Honor. Sherry, I have one. I don't think I saw it in the slides. How much in the red is Unity Point running?
This
for
service costs us
service?
about $1 million a year in losses.
Okay, so you guys are losing $1 million a year on
Yeah,
this?
we
Okay.
are. For the 911 component, yeah. Yeah.
So question,
Oh, yeah.
Sherry.
Sorry.
This is Greg Nichols. No,
Yes.
I know. This is weird. So how do you partition or how do you split apart the transfer, which the hospital's required, and the 911 when you have the same equipment, same personnel responsible for both?
Yeah, absolutely. Good question. And it is very difficult to dig into. I would say that when we do financial, we can do it based on billed codes. That's probably the easiest way. We also have call data so that we know how many 911 calls we are responding to. So we know how many patients we're touching when we're on those calls. And I would say out of the total, I think it's around 33-35% of that total volume is 911 right now.
And that total, my equipment, the question is how between equipment and manpower, or does that really cost out? Because you'd have to have that equipment, whether you're doing a 911 or just doing a transfer.
Yep.
And the personnel have to be on call, available, whether you have transfer or 911, correct?
Yes. The way it's teased out, we can partition that through our financial analytics to kind of identify what portion of that for labor cost and equipment, et cetera, would fall under the 911 category versus the transfer category. So we do have a sense through the indirect costs, which is really a piece of that, and that is calculated by our financial analytics, yes.
So is the transfer cost covering itself? Is it in the block?
I wouldn't, that would be, I would call it break even, barely break even.
Thank you.
Other questions?
Any other questions?
Your Honor, if I may.
Yes, you may.
Sherry, thank you,
Yeah.
by the way. So the money you're losing is just because you can't bill, or Medicare or Medicaid are paying such a low amount?
Medicare, Medicaid, uninsured, refuse to come. We could have a whole other conversation about 911 abuse. And, you know, when you show up and the patient doesn't, somebody else thinks they want help and they don't. So all of those things add up over the months to create that financial loss for us.
So help me understand, in your expertise, what do you see? I mean, obviously, we're going to get into this request for proposals, but what do you see as the ultimate answer for Marshall County?
For personally?
yes, your
Yeah,
I want
my
your personal opinion.
personal viewpoint, this is Sherry talking, nothing else. I think we need a county-run service. And I think we need to really evaluate where do we need to have ambulances stationed and the crews stationed, and how do we do that as a county-run service? That may or may not be possible. I think we have to really consider our excellent volunteer services. Some of them are robust enough, I would say, that maybe they want to be a piece of something, you know, or they want to handle their local community. So there's a lot to balance out in this whole big picture as we look at the volunteer services across the county as well.
How many of this list of communities, I mean, obviously, you're supporting all the unincorporated areas, or most of them, from, you know.
We go everywhere, yep.
So how many of these actually have ambulance service right now?
I'm trying to think. I didn't bring that particular map. I want to say there's probably 5 Do you happen to know, Ron? I think there's 5 volunteer services inside the county besides Unity Point Health.
That actually have.
State Center, Gilman, Green Mountain, but they only have 1 responder now, I believe. And then up near. Thank you. Yes, Liscum. And has a service as well, volunteer service.
So do you honestly believe with the levy, if we go this route, do you honestly believe, in your opinion, that this would be self-supporting then? We would be able to be staffed, the equipment, everything?
I would say yes, I think so with the levy. Now, I will tell you, it doesn't have to be us. Yeah, I mean, it could be another service entirely. It could, there's a lot of options as to how the service gets provided.
But legally, we could contract with a private carrier like yourself or
You could.
a private
You could,
company?
yes.
Okay. Doesn't have to be incorporated into the county or the city government?
Correct.
Okay.
I will also add, currently today, there is no contract or agreement of any kind that this service be provided, which as a citizen makes me a little alarmed too. So obviously, we want to work collaboratively to find a solution because there's a lot of invested parties here.
I had that conversation earlier with a friend. It's like the state mandates, we have police department, state mandates, we have fire department, but you guys could stop running 911 right now.
Yeah.
I mean, you could shut it down today.
We could. We're not going to do that. But
I
yes,
understand,
and there's nothing legally binding that says it's required. That's right. Yeah.
Thank you, Sherry. Thanks,
Yep.
Your Honor.
Yep.
I think being on this committee and you sit and look at what Marshalltown's whole system of doing things, the smaller towns are really struggling to provide ambulance service. I don't think that's going to get better for a very long time. Unity Point certainly doesn't want to continue losing about $1 million a year or more. So I think what this proposal is, what they're going to come back, they're going to talk to everybody. They're going to talk to the hospital. They're going to be talking to you guys, the supervisors, the local people up in Liscum or Gilman or State Center, county, everybody, and then gauge what is here and then put together some proposals for us to look at. And that's what this is for. What we end up with, I don't think anybody really knows. But we can put together something that's robust and can go forward for Marshall County, because every county is different, how everything operates. And it does get very complicated as you start digging into all this stuff. What Medicaid pays, what Medicare pays. Well, why can't the hospital just bill more? Because they can't by law, okay? And I guess I hadn't given it that much thought myself that Marshall County, that we don't even have a contract with Unity Point. It's just always been there, so we just assumed it'd always be there. So I really think we ought to move forward with getting these consultants in, letting them do their work, and see what they come back with, see what kind of options we have. Because the last thing I want to do is, there's areas in Iowa right now that don't have ambulance service. And that's a scary proposal.
Your Honor?
Go ahead.
Sherry, I have one more question. Sorry,
Go ahead.
Sherry. So the question, Sherry, is how would this affect the transfer service? Would if the ambulance service becomes, say, county, this is just hypothetical, understand that, would they be responsible for the transfer services at that point in time, or would Unity Point still be responsible to staff, man, and equip for transfer service?
Unity Point Health would still be responsible for the transfer service. That is the responsibility of the facility, to make sure patients get where they need to go after the emergency room visit. So, as long as they're staying in care, I should say that. So that would be our responsibility.
Thank you.
Have any other questions or comments?
Your Honor,
Yes.
I like this collaborative approach, especially the equal sharing of the proposal between Unity Point and the county. I think that's completely fair and reasonable. The one thing I would caution or maybe ask, I know Chief Cross isn't here, to outline or try to understand what that would look like if the city of Marshalltown were forced or decide to handle this in-house. And the only reason I bring that up is not that I have any doubts with the proposal, but with the timeline that was provided here, I don't want to get 18, 24 months down the road and we don't have any workable solution that we agree from a city perspective. And Unity Point says we've already incurred another several $1 million in debt. We're ending that service. So just to make sure our bases are covered, but obviously do support this proposal.
Yeah. I believe the proposal is due, or the work product is due back August 15th. So it's a somewhat quick turnaround for us to be able to look at and dig into it.
Your Honor, Chris has his hand up.
Chief Cross is online.
Hi, Council. Can you hear me?
Yes, we can hear you.
Hey, I just wanted to, this is Christopher Cross, I'm the fire chief. I'm able to answer any questions that any of the counselors may have and provide a city slant to any information that's been presented or offer any context or clarifications that anybody might have.
Chief Cross, this is a question. So if it become a county service, how would that affect 911 and Marshalltown sending out equipment, sending out equipment for emergency calls as well?
I believe that'll be covered in the report back.
Yeah, I would not assume any, if the fire department doesn't have any transport responsibilities or any ambulances within the fire department, we would intend to handle all of 911 calls within the city limits in a similar fashion in a first response type of manner.
Your Honor, you looking for a motion? I'd make a motion to direct staff to follow the memo as advised, is coming in a 1/3 partnership with his consulting firm.
Second.
Okay. Before we vote here, let's have some public comment.
Thank you. Jim Shaw, 522 North 2nd Street. I don't know if this is relevant, but obviously the people who answer my question are here. So what happens if something happens to me and they call 911? Do I? Sing.
Greg, Yeah.
I'm muted. I was muted.
Did that do it? Okay.
Jim,
Shaw,
Jim,
522. And my question is, say something happens and they call 911 for me. Okay, unless I'm unconscious. So does that, I don't know if that goes in, then am I going to be transported somewhere else, or is it the 911 thing, or?
I think you're getting ahead of yourself.
Okay, I didn't know.
No, I don't think we're going to know that until we get everything back and who's responsible for
I
what.
just figured out, people hear me, they know, and, okay, that's it, thanks.
Hi, Lee Botter, 13 East Southbridge, Botter Consulting. I've been in the industry of health insurance for 40-plus years, coming from home office, Blue Cross Management, out to the field, opening my own shop. The question I have for Unity Point,
Muted.
pertaining to the city, is about, have you done collaborative efforts with the insurance? So it's not a situation where it's here they're coming to us and you pit against each other. I have found lots of success when we've done the round table and sat down, and there's a representative from the insurance carriers, et cetera, and I could get you in contact with different people that would have that opportunity to sit down. So we've got, the city, we have Unity Point, we have the kid from Liskin, who happens to be my grandson, who was part of that process up there. So have you done that?
To my knowledge, no, but I'm not sure I don't know if there's been pursuit of it. And I think there have obviously been some traditional challenges between the provider and insurance overall.
Absolutely.
So, but I'd be happy to explore it.
Yeah, I just think you might have some success if you go that route. So, thank you.
Thank you. Anyone else? We have no motion in this.
Oh, Mike, right?
You probably started it.
I am in support for us to approve the consultation and also support Marshalltown and the county to work on putting this on the ballot. That being said, I am frustrated with a lot of things that relate to the ambulance desert issue. There's no denying that expanding Medicare to everyone is the only real answer to many of our healthcare issues we face in the U.S. Every single developed country besides the U.S. has figured this out and has healthcare as a right for their people. The bill in 2021 and the discussion that the lazy state legislator has pushed onto us is far from that. At minimum, the bill should have been declaring EMS a necessary service on its passage and giving each county the necessary funds to implement the infrastructure. It's lazy and cowardly to push this discussion on Marshalltown and pretend they don't have the ability to easily raise the funds at the state level by taxing the wealthy. These cowardly leaders hide by shifting the discussion to the counties and towns so they can keep pretending cutting or restricting necessary programs like Medicaid has no consequences on their constituents. This discussion tonight should have been us accepting state funds to implement the necessary ambulance infrastructure across our county, not to figure out a way to do it from scratch and with zero state funds. And let's be clear, the discussion is not in our scope. This conversation is for politicians like Kara Warmy, David Bloom, and Kim Reynolds to stop hiding from and actually put a real solution forward. Since the levy question will likely be on the ballot, I want to ask 2 questions, and maybe you need a point where the consultation can later answer. My first question is, knowing that Marshalltown by itself has a population greater than almost every county that has approved this levy, is Marshalltown forecasted to become an ambulance desert in the foreseeable future? And my second is, what specific benefits would Marshalltown receive if the levy is approved? To end, I want to reiterate that I support approving the consultation because it will give us a better picture of the situation. And I also support having the levy question on the ballot. Thank you.
Okay. We have a motion and a second to approve this contract.
Yes, we do, to bring forward a proposal.
Okay. Let's have a roll call.
Mitchell?
Yes.
Nichols?
Vote, Greg.
Yeah, I'm trying.
No, just say it.
Yes.
Schneider?
Yes.
Thompson?
Yes.
Fonseca? Yes. Kell?
Yes.
Lottie Hoff?
Yes. And with that, meeting adjourned. Thank you for coming. Come up here. That. I don't know, we just rolled through it. I'm all right with that.